country is in one form of lockdown or the other. Not total, the point has been made. The president tweeted yesterday. Yeah, that's it. Yeah. The communication was via Twitter yesterday. The president also was sort of appealing that people should, comply, that he was aware of the difficulties. So what we'll do on this program is, touch base all over the country where we have our correspondents and where we can bring in people on Skype and just sort of see where we are now. But Asuka, you have global figures,
Yeah, as it stands now, the world is really, really on the edge. And so far, it has crossed the 500,000 mark. And the death toll...
That is in terms of people, confirmed cases?
Confirmed cases. That is about 530,000 confirmed cases. And then the death toll is about 24,000, more than 24,000. And from all indication, it seems the deaths, especially in the US, which is going closer to even China, the death toll in China, because it has already surpassed that of Italy, so it's going very close to China. So
it's like US is becoming the epicenter.
Yes,
now in the West.
But they're also making frantic effort to see how they can reduce the number of deaths. They don't forget the Congress actually, brought out a stimulus plan, $2 trillion for them to see how they can, cushion the effect of people that will be staying at home, as well as also getting test kits. So you don't need to, go to the hospital, but you have to do that in your home to know if you have the virus, And because testing is the most important thing. Because once you have the test kits, you don't need to say, okay, I want to go to the hospital. And that is why most of the hospitals are overstretched. And from the NCDC, I think they're also having that is the one of the challenges they'll also be facing in Nigeria, testing capacity.
We got a big donation of some of these, including test kits, additional test kits. This will be helpful.
Yeah. I think it's going to be helpful. It will be helpful, so people don't need to start saying, I want to go to the hospital, I have cough, or I have, because sometimes you might have malaria, and it's something that you can easily do at home, So if we have the test kits everywhere, maybe, for instance, they can bring it into the office here, and everybody will have that in their homes. Motor parks, the same thing, and people can do that individual rather than going to the hospital to make sure to fill up the hospitals.
We have packages, all of which we have actually put out on our major bulletin of the day last night. Maybe we could look at some of the efforts being made to contain, a large number of people should that eventuality arrive. I think, first of all, we got to know from the president's tweets that there are great efforts about this going on in Abuja, but in Lagos here, southwest of the country, the former Onikon Stadium is being converted. I think we have that package. Maybe could we see the package on isolation center, the Onikon Isolation Center, and efforts that are going on in that regard?
Has joined the rest of the world in the fight against the spread of the deadly coronavirus. With a population of more than 17 million people, the Lagos State government has planned to set up no fewer than 7 isolation centers in the states. With the number of infected persons rising on a daily basis, Lagos State is the worst affected in Nigeria. A visit to the former Onikon Stadium, now known as the Mobolaji Johnson Arena, shows that workers are assembling beds that would take no fewer than 100 people. The isolation center on the island will be for testing and consultation of people who show symptoms of the virus. The coronavirus has killed at least 19,000 people across the world. TVC News can confirm that other planned isolation centers will be in Ikorodu, Badagry, Epe, Ikeja, Agege, and the one right behind me, the newly renovated Mobolaji Johnson Arena. Mian Akiri, TVC News, Lagos.
Okay, then. So some of those figures probably need slight updating because this is such a dynamic situation. Things are changing. The figures he gave as of the news yesterday.
That was last night.
That was last night.
510. So now it's about 530. The death toll is like 24,000 now. So you can see it's moving. The numbers keep increasing as the days go by. Yeah.
Okay, in
By
fact,
every hour.
there's a graphic up. I think is that.
And this is for Nigeria.
Yes, this is taking Nigeria out of it. So total cases we're seeing here 65 active cases,
Yes.
whatever that means, active cases, and then total discharge 3. And we'll be able to confirm when we have on one of the public when we have some of the some spokesperson if what exactly gives with the figure we're hearing about 6 about to be discharged. We need a definitive statement on that because it's about to be. So we can only make assumptions, but one has to be very careful and get definitive
Exactly.
statements.
I think at this period, the media needs to be very, very careful, because especially the social media, it's been always awash with, information and figures that cannot be very, very substantiated. So for this period, I would talk to my own colleagues. Let's not just rush into the newsroom to say, okay, these are the figures. Let's wait for those who have the original figures to come out with those figures. Yeah, because if we now begin to say 6 people have been discharged, who said it? Who is your source?
Well, actually, the way they tend to be careful. But you see, the way they phrase it, it's almost as if, not that I mean to disparage, almost like being too clever by half.
Yes.
About to be discharged.
Exactly.
But people will just see the word discharged.
Exactly. But it's going to be like that. So by the time they say, okay, 1,000 people, for instance, are in the hospital bed or about to be in the hospital bed.
So these are
so let's wait for those who have confirmed information or authentic information, verified information
Indeed.
to come out to tell us who is discharged and how they've been discharged, so that we don't go into the public and begin to say about to
exactly.
So let's just be very, very factual.
And where phraseology like that comes from, about to. Because what are the implications of about to be discharged? Because it seemed like very good news to hear that in Lagos 6 patients about that would imply that the only reason you're about to discharge them must be because they have been cured.
Yes, exactly.
Now there are aspects to the medical people being able to declare you cured.
Yes.
So why are we bringing the about to matter? Why are we not waiting for the definitive statement?
Let me also bring this in. There was a time the Italian guy, there was news everywhere that the Italian guy is now hale and hearty, and then the commissioner now came back and said, okay, he's doing well, he's progressing, but they still have one more test to go.
These are the things I was talking about.
You understand? So if the commissioner didn't come out, then everybody would just, okay, the Italian guy is healed, is about to again to be discharged. So, until the guy was finally well and he was discharged. So let's just, always respect and give those who have verified information, like the NCDC, and even the commissioner, like Lagos is doing brilliantly well.
Even the president commended
yes,
Lagos in
Lagos
his,
is doing, because right now Lagos seems to be the epicenter of the whole COVID-19, and we need to, everybody has to support the Lagos state government, in trying to address this issue.
Talking of that as well, in the president's statement yesterday, indeed, due note was taken of the efforts of Lagos state government and how crucial it is. In fact, a grant was announced.
Yeah, 10 billion naira grant was given to Lagos. And if you notice, even the private sector, they are also giving Lagos that support. Like the isolation center you've just seen now, the 100-bed capacity that we've just seen. is fully funded by GT Bank. You know, I hope my
And-
commercial
and-
directors will not come.
And also, there is news that UBA,
Yes,
you know,
also give them one billion. You know?
$5 billion, but
You know,
but that is for
all
all of
yeah,
Africa.
Africa,
you know, and
and
so
so Lagos has a chunk.
Yes,
you know,
a
from
big
it.
chunk.
And why they are doing this is because they know that Lagos is like the oxygen of Nigeria.
Yeah.
You know, and if you notice, while other states can easily say we are shutting down borders or shutting down our land, air, sea, everywhere, Lagos is trying to be a bit careful not to, you know, shut down the entire economy, because most people, you can produce outside your states, but where the consumers are in Lagos. You know, then people you can also get things from Lagos and you move into other states. So the Lagos state government is trying to, you know, contain the situation, and the only way it can do that is through the cooperation and intervention of everybody, and that is what everybody is trying to do, especially the private sector. They are trying to see how they can help Lagos to contain it. If we have 44 confirmed cases in Lagos and everybody is traced,
yes,
I bet you the spread, and then we obey what the governor says, which is stay at home if you are not doing anything. If you don't have any important thing to do, stay at home. Maintain the social distancing, that is, the social gatherings. Going to church, I think for now, you can do your own church in your house, you know, and then washing your hands properly for at least 20 seconds, just like they're saying. Don't touch your face, use face mask, although some people have argued over that.
that can be
you
your
know,
contribution to the effort.
you know,
to
just
the overall
little,
effort.
because
While-
the thing is, it's spreading.
Yeah.
And the only way it's spreading is because of the person-to-person transmission.
Now, that's what the Minister of Information was speaking about yesterday when he talked about us being on the verge of community transmission.
Exactly.
We're on the verge, because people have been, there's so many things coming into my mind. The other thing is, I was reading somewhere that the reported increase that Lagos has witnessed, some of it is coming from vessels out there on sea. You know,
Yeah,
you know.
You know, so that is where the president also has, because he mentioned the vessels yesterday. You know, he's saying any vessel that is, you know, 14 days on the IC that coming, but those in the vessel, they must go through the screening.
Yeah.
You know, and they must be around there. I want to believe the port health authorities will be there.
Indeed.
To make sure that they are screened and they are kept isolated, you know, for 14 days.
And while we're almost in the same breath, he was exempting
oil and gas.
Oil and gas, because
Yes.
in any case, the human involvement is very,
Very
very
minimal.
You know, that kind
Exactly.
of thing. But since we're talking about efforts of corporate society, you know, also getting involved, you've spoken about a couple of banks. Access Bank, the largest bank, I understand, by lending, you know, that is reported to be cooperating with
It's
Dangote,
Yes.
Africa's richest man, you know, in this whole effort as well to sort of contain this, because everybody seems to be aware that, going from what Lai Mohammed, Minister of Information, said yesterday, that we're on the verge, if we're not careful, of a community transmission. So far, it's been people bringing it in.
Exactly.
And so if we're able to trace, we're able to sort of snuff out. But once the thing takes hold on a community level, where people who have not been anywhere before, have not left their villages, are now beginning to transmit it to each other, that is...
The funniest thing is, when I send my reporters out, people are still ignorant about coronavirus. They don't believe, some people don't even believe it exists. You know, because some people say, it's rich man sickness, because they
Yeah.
don't come in contact
Yeah.
with,
Yeah.
you know, maybe a white person or somebody that is coming from abroad. But the thing is, what if, like, I was coming this morning, driving in the bus, 4 behind, 4 everywhere.
Yes.
And it
There
means
usually are
that
3
people,
rows, right?
there are supposed to be like 8 in that bus, because that is what the commissioner of transport actually said.
About 60%
He said,
full.
yes, you know, so it has to be 8. But this one, it was full to capacity.
Yeah.
You know, so
That's
if
a problem.
what happens if for one of them in that bus actually came in contact with someone that had the virus.
So these, and yet at the same time,
And that is community, because we call it community. If you are
is.
saying, just like Alhaji Lai Mohammed said, you know, so that is where the community comes in. So people must also also tell the driver, they said 8.
And going back to the point that you were making about people not wanting to believe, I'm sure, look, it's a matter of them, they're not wanting to believe, because I saw Sharon Ijason's report going back to Sunday, I believe it was, where she went to the market. And there was, a market woman saying that she doesn't actually believe that there is corona out there. Now, that can't be true. She must know that we're not all going, governments around the world, governments in the country are going to all this trouble and hullabaloo. It can't be for nothing. It's that it doesn't, she's not happy that because she's a daily work and eat kind of a person.
Exactly.
It's going to make life tough. And the president apologized for that. That look, he understands. He was being compassionate that he understands that, but we've got to do what the people. So all this idea about I don't really believe that corona is there. What you said earlier, I don't even believe that it's a black man's idea. People just have to accept the fact that we have a danger on our hands. Such that has not been seen in living memory.
Exactly.
The closest that people are talking about is the Spanish.
No, even the Italians. Now, okay, now the market woman might not even have the opportunity to watch, foreign channels like we. But the thing is, the virus has really, really cost a lot to the Italians, because even their hospital, the reception area is now like a ward.
That's the problem.
People are now lying down on the floor. I'm talking about Italy.
Yeah.
Lying down on the floor. Sometimes there are no doctors to take care of them.
So if we're not careful, we could actually have a crisis on our hands.
A serious crisis. So, and that is where...
Let's come back and talk a bit more about this. Let's take, actually, I don't know, what package could we take next? Okay, let's look at the stay-at-home package. Let's look at the stay-at-home package that we have.
As the numbers of infected persons increase globally, so are concerns over the spread of the coronavirus pandemic. In Nigeria, more new cases have emerged and the government is rising to the situation. The stay-at-home order by some state government is one of the measures, but there have been low compliance.
In fact, the virus is very something that is bad, But for people, you need to go out.
I can if there's a provision. Or, for instance, if my boss will stay at home, at the end of the month, your salary will be paid. I will stay.
In Lagos, the number of cars on its roads has reduced, but the number of pedestrians haven't. Jacqueline, a petty trader, just like others, say she had to go out so she could cater for a family.
My question now is that, okay, if I'm at home, what am I going to eat and my baby? This is my question. Now, I did not go to school. Then what am I going to eat and my baby? I have a baby, two children. What am I going to eat? And I don't have anybody to help me. This is what I'm using to pay my baby's school fees.
Amidst all this young man was sighted sharing free masks and gloves to these beggars and some passers-by.
Like myself, I have these ones. When I go, I share, I give to people. I give to people free of charge. Because a lot of people cannot afford to buy it. There is beggars on the streets, they cannot afford to buy it. And it's expensive. The marketers, they are selling it very expensive. Like this one now, I bought it 10,000 naira.
Regardless of the reality of the virus, he also believes he has to go out in order to make ends meet.
So it's more like a struggle for survival now for some residents of Lagos who believe that the stay-at-home order given by the state government as part of the effort put in place to spread the curb of the virus. Most of them believe that the stay-at-home order would not work as they have to go out and get something to feed their family with. Abimbola Agbebi, TVC News, Lagos.
Okay, thank you, Abimbola. That report went out earlier, as I've said. Indeed, what we're doing is we're getting an overview. Now, let's look at some of the things that fellow citizens were saying in there. it brings up the question: how well has the message been put out there, been transmitted to every nook and cranny? What exactly this COVID-19 virus is? Because the statements you hear seem logical, but they're not. That young woman saying that if I were to stay at home, what will I eat and my baby? She's missing the point.
Exactly.
Does she understand that there's a clear and present danger out there that she could do herself irreparable harm? I doubt it.
Exactly. You know, the thing is, I want to well, let me put it from this before I get there. I have a friend in the US. He's a nurse. I called him yesterday, how he was coping. He said, Asuko, pray for me. I was saying, okay, why should I pray for you? We are all praying for, each other and all. He said, pray for me because the number of deaths in our hands is just increasing. I don't know. I can be infected, because they are meeting people who are infected by this virus. And people are not coming to work anymore, so they are also overstretched. They are begging people to work in the hospital and giving them good money. But he's saying, pray for me. It means he's seeing death.
They are,
they are seeing death.
Clear and present danger.
Exactly, So,
and when you contrast that with what we are doing here,
is different.
Where people are incurably optimistic, and it's quite frankly foolhardy.
The thing is,
and people are saying the wrong things.
Exactly.
They're saying we saw Ebola away. Therefore, this is not going to be a problem. These are the point.
Ebola is different.
So it comes back to the question of how good a job have we done in spreading the knowledge of what this is about.
To be candid, we've not done enough in terms of the awareness campaign. We need to start speaking the language that everybody will understand, to know that it is death that is staring us.
Because the problem, Asuko, is that people, including that young woman who was saying that, what will I do if I stay at home? She's saying that because she doesn't realize the potential magnitude of the situation.
Definitely.
God forbid. The only thing that our people apparently would sort of key into, God forbid, and God forbid one more time, is when people begin to die anyhow, as we say locally.
Exactly.
Then they will say that, oh, is that right? I'm not going out anymore. So how do we now get to giving them information to prevent that eventuality?
I pray we don't get to that situation. The government will also need to step up its efforts in terms of sensitization. We down in TVC, we are trying.
We're trying, but what can we do? What can we do alone? Now, it costs money. Let it be said. It costs money, and when it comes to political campaigns and elections, I think people they earmark a lot of money.
Of course, I know that one is different.
There's a lot of money going out.
That one is like a job.
You see now,
like a job.
That seriousness and more money than that is going to be needed if we're going to get to the places where they don't have WhatsApp, they don't have Twitter, they don't have internet, but they need to know.
You know what? There is no money that is more when it comes to human lives. If we need to break the bank for us to sensitize people, for us to push that language that they understand, if it's Yoruba that will push out, let's speak that Yoruba and send it out. If it's Hausa, if it's Igbo, if it's Pidgin, if it's even my language, Bibio, Efik, whatever language.
We've not got to that level of desperation yet. All of us are being optimistic.
That is the problem. The only government that is trying, that is desperate to make sure that this thing does not overwhelm us, seems to be Lagos.
And maybe the federal authorities.
And then the federal authorities. But they need to also push the National Orientation Agency. Because I know that they have the wherewithal to do this. So why can't they push it out? Go out, make sure that people understand that this thing is more or less like deadlier than you know.
Because
because people, okay, look at that woman. All she knows is I'm going to how much. Okay, for instance, if you are able to count what the worth of what she has on her head,
exactly,
you you'll be amazed.
Which brings us perhaps, Absukwa, to this whole matter about you hear in other clients. The president was talking yesterday about immediately providing a package, of so much, I forget what the figure, of so very much, because there are people who are going to be just about helpless without a grant. We're hearing these lovely stories coming from the West of stay at home and you're going to be paid. Stay at home. You will be, I'm hearing figures like you will get 80% of whatever your salary is. Don't worry about it. Don't come looking for it. We know where you are. We know where your bank account is. We're going to credit it. You have money. Stay at home. Don't come out. Now,
that is you are going to cause a national crisis in Nigeria. Because even that lady that is selling pure water, sachet water, do you know if she has an account? If she doesn't have, how do you know? Even if they say, okay, we are going to give you maybe 5,000 naira, for you to, calm down, and there are so many people who are not having bank accounts in Nigeria. So the other day, I think we have like about 40 million who have been registered as has BVN, that have BVN in Nigeria.
And we're talking of a country about 200 million.
200 million.
200 million.
So what happens?
That's just
20%. So what happens to the others? These
are the things that the authorities are grappling with. And quite frankly, when the president was pleading yesterday that the populace please understand and, as it were, join with them in this, because government can't do it alone. In fact, without the populace joining with government can't do jack about this whole matter. But they still have the challenge now, I think, just looking at it from our point of view, of people not taking it seriously enough. But then, if seriously enough means staying at home, people are asking the question, so what do you want me to eat? And so they're ready to come out.
No, the thing is, we know, people need to know that government have given them like a space, a period of time, maybe like 1 week. I know in Lagos it's just a week, from there they will review. So if I can make money for a week, stock my house with the few things that I believe I can eat with my family, I don't need to come out. There are some things that I've denied myself of because of coronavirus. So it is the sacrifice that everybody will have to pay. Everybody around the world are also making these sacrifices.
Indeed.
And I think the Nigerians need to understand
this. I think we need to keep on returning to the point that Alhaji Lai Mohammed, Minister of Information, made, that we are on the cusp here of community, community to community, person to person community.
Exactly.
What is the word?
Transmission.
Transmission, and infecting ourselves. If we don't start doing something different from what we are doing now. That point was made by the Minister of Information yesterday, and I think it's an important one, that we've got to be careful so we don't get there. And the only way we won't get there is if people know that this is a radical situation that requires a radical approach.
Exactly.
Okay, we've got to go on a break now. Stay with us, please. We'll be right back. If the phones are working, as always, we've had this challenge for a couple of days now, but if they are, we'll put them on as well. Stay with us, please. Okay, welcome back. It's quite frankly the coronavirus banned all over the world, all news media all over the world, indeed in Nigeria. Very few subjects. Even suddenly election matters have paled into insignificance. The Supreme Court will actually be ruling on the case in...
which they have done anyway.
In Zafar. They have done it.
Yes.
Did they throw it out or did they allow?
Yes, of course. Of course.
So they followed themselves, sorry, we've said it, it's final. And it's incompetent, so you can't get a change.
Yes, exactly. So Supreme Court issue is...
Suddenly nobody...
We are thinking about our lives now.
We're thinking about our lives now.
Yes.
Somebody was saying to me, somebody was saying to me that suddenly nobody's talking about Boko Haram anymore.
Exactly, even kidnappings and all that.
All of that has gone down because we're still trying to get our lives together. And
because so many, we are just trying to see what this whole coronavirus thing is about, and we don't know where it's coming from. You know,
That's-
we all know
that's the
that okay, it's
scary
from
part.
China. That is,
Doctors
but we
don't
don't
know-
know if it's
doctor-
just beside me or
Doctors tell
anywhere,
us up
you know.
front that they don't know enough. They don't know anything, quite frankly,
You know, so
about coronavirus.
It's just for us to just take this simple procedure, which is wash your hands, use sanitizers, social distance yourself, and things like that. You know, so that we can keep ourselves first.
Okay.
You know, because we don't want to get the symptoms. Because by the time you get the symptoms, that is when you can now move yourself to the hospital. So, but make sure that you first do the simplest of things, which.
We had earlier the Lagos end where we saw at the Onikon Stadium, you know, that is being converted, and I think we have a report also from Joke in Abuja on the situation in Abuja. Maybe we can take that situation and see what it's like in Abuja, preparations for this to contain it.
Federal Capital Territory shares boundaries with Kogi, Niger, Nasarawa and Kaduna states. Daily increase in the number of coronavirus infections in the country is forcing many states to take drastic measures. Niger has declared a 10 a.m. to 8 p.m. curfew. Kogi State has closed all entry points, insisting that passengers of commercial vehicles coming in and out of the state must go through health checks and convey a limited number of passengers in line with social distancing. Train services have been discontinued in Kaduna State. Only Nasarawa State appears not to have taken any restrictive measures for now. The popular Jabi Motor Park in the nation's state of power is an all-commerce park conveying passengers to all routes. Vehicles are readily available to Lokoja, Kaduna, Kano and other neighboring destinations, but conspicuously missing is Minna, with other routes in Niger State. The curfew in Niger State has affected motorists who ply that route. Some of them have had to change their destinations if they must earn a living. Here, as in other motor parks in Abuja, hand sanitizers are readily available for anyone wishing to enter the park. But that is where the precautionary measure ends. The park is packed to capacity. Many seem unaware of the need to wear masks and hand gloves.
What we see is that the way out is Almighty God. And when situation come like this is prayer.
It's very, very difficult now as it is. Because once something is real, we have to protect ourselves.
Still, vendors are cashing in on the situation to make brisk business by hawking face masks and hand gloves. How safe they are with how they have been exposed is another matter entirely.
They chop 2.5 for one bag. So I'm going to chop 1,000 for one bag.
The price of human beings in this park shows that social distancing is not being observed.
The number of passengers we used to carry, that's what we are carrying now, 331.
Authorities at the various motor parks in the Federal Capital Territory say they are doing their best to curtail the spread of coronavirus, but health officials have more work to do in ensuring that the right things are being done. Joke Adisa, TVC News, Abuja.
Indeed. Again, our thanks to Joke. You know, stay safe out there. And that report was put out earlier. Yeah. We also have Helen, our lady Helen in Abuja, on the market situation in Abuja. Let's take that.
As the number of confirmed coronavirus cases continue to rise by the day, state governors are taking drastic measures to help curb the spread of the virus. Most governors are issuing stay-at-home orders to their citizens and putting their state on partial lockdown. The Federal Capital Territory Administration is not left out, with the Minister of FCT ordering the immediate closure of shops in the markets and neighborhood centers, except those selling food items and other essential commodities. I visited some of the popular markets to see the level of compliance. Most shops were under lock and key, while hawkers of hand sanitizers and face masks were seen all over the markets. Ugu Sunday normally sells cosmetic products. He has now resorted to hawking hand sanitizers and face masks due to the order on the closure of shops stocking non-essential products.
As a family man, I said, let me brought this one so that I will, because of living, said, let me sell this one and get more money for my children.
The level of compliance is total. Those of us who are at the head office, we have to form teams to go around to monitor level of compliance, which is what we are currently doing. So we've been in Wuse, we've been in Kaura, we've been in Gudu and other places, and now we are here. And what we're seeing, we are very, very satisfied.
The frenzy to buy up food items is high as customers fear that markets are only being given a period of grace by the authorities before they are all shut down. Many of the truck pushers were seen fully engaged, conveying food items for buyers. Most buyers complained about the hike in price of some essential products. They want the authorities to put in place measures that will help regulate prices of items and stop traders from taking advantage of bad situation.
2 weeks ago, I got tatashe for like 4,000, but yesterday it was 9,000. And the crowd in the market is serious.
Before it's 1,000 naira, 1,002, but now it's 3,000 naira. So I'm buying even 5,000, but I buy 2,500. This nose mask, before we sell it 1,000 for a pack, or for a pack 1,000, 1,500 for a pack. But now it's 15,000, 13,000. It's too much. We sell one 300.
We are coming back.
The market authorities were seen going around the market to ensure total compliance by shop owners stocking on essential commodities.
As the non-essential product shops are locked, this part of the market is very busy. The authorities are optimistic that this level of compliance will help in curbing the spread of the virus within the FCT. Helen Osameda Akins, TVC News, Abuja.
And our appreciation to Helen as well. Now, something came out there. As government has said, look, shops are going to be closed, markets will be closed, but for essential items.
Exactly.
And people are hustling to wangle their way into the category of essential items. Even the young man, you know, hawking face masks. Yeah, he was making the point about. So two things are going on. One, I don't know if it is just economics at work or if it is man's inhumanity to man. People are profiting off this. People, you didn't buy it at the rate that you're now selling it. One just hopes that those people know what they're doing and they will actually be able to live
I think it's just is a very sad situation.
To enjoy the exorbitant profit.
It's a sad situation because even in most countries, these things are given for free.
They just don't see it from that point of view. It's an opportunity to make money, which goes back perhaps to the point of we don't know how serious this is.
Exactly. Is the value we place on our lives. Because if something of that face mask that was 1,000 for a pack before, you are selling for 15 and you come out in national TV to say, it's 15,000.
And I'm doing it so that my family, I'm doing it so that my family and my children we can have something to eat. You're not getting it.
He cannot say that he's doing that for his children.
You're not getting it.
He's doing it for himself. He's greedy.
And he also doesn't get the larger picture.
Exactly.
He doesn't get the larger
because
picture.
Do you know how many people that would have loved to buy at that 1,000, but because he's selling at 15,000, they can't? Because I know there was a time, even in this company, that wanted to buy. We couldn't even get, not to talk of even sanitizers, until the things started coming. And I think this should be a time for most manufacturers to be inventing, to start seeing how they can manufacture these things right here in Nigeria, from sanitizers to gloves to face masks and all that.
Well,
Nigeria should start thinking. So we shouldn't be thinking of everything we have to import from China, and all that. So we also have to think about ourselves.
And the face mask, there's something of a controversy because
because some doctors are saying that we shouldn't use.
They're little more than useless.
Exactly.
that the ones that really are useful are, way beyond the reach of the ordinary person.
That's exactly, because what they are saying now is that you are supposed to breathe out carbon monoxide, but we are breathing in, taking it out, and also taking it in again.
Let's try Dr. Ronke Agoro again of Lagos State. Hello, Dr. Agoro. Can you hear us now?
Good morning. Can you hear me?
Hello, Dr. Agro. Good morning.
Good morning. Can you hear me?
Yes, we can hear you now. We can hear you now. Okay. So thank you for joining us. Well, one thing you could clear up for us to start with, please, is the apparently good news that 6 patients, 6 COVID-19 patients in Lagos are about to be discharged. Could you explain that particular construction? Which one is about to be discharged? Are they well? Why is it phrased like that? Did you put that out in Lagos State?
Okay, thank you very much, Mr. for
Yori?
the question and
Yeah.
for having me, Lori, for having me there on your program. The commissioner made that comment on a radio, I believe, yesterday morning, and when he made that declaration, I should say, he knew what he knew, and he was sure. And then we just want to be careful. So that's why it's made. They've come up negative twice, and we're just being careful. If you been on the NCDC website, one of the patients did go home yesterday.
One of the 6. One of the 6 that are about to be discharged, quote unquote, about to be discharged. One of those 6.
Yes. So he wasn't eating. He was hopeful and excited that the patients will be going home soon. He didn't know because of protocols and all that what exactly. Hello?
Yes, we can. You're still with us.
Yeah, when exactly they will be discharged, and that was why he said
okay.
Possibly today. Just to be honest, I believe he was being cautious when he said about to be released. We are doing everything to make sure that we have, if 0.10 error margin.
Okay.
That's why he didn't come out right away to say yes and all that. So we wanted to be double sure, triple sure, and anything that goes above that.
Okay. So and what you've just said is that there are certain protocols to being declared cured. You said two tests are necessary. 2 negative tests are necessary.
Yes. After 2 negative tests, the patient is technically deemed negative. That means that there's no detectable virus in the person's system.
Okay.
That science can pick up. So make sure that we're all on the same page and the person being discharged back to the community is safe for everybody. So we're doing that swiftly to make sure that Lagos and the entire nation is safe.
Okay. Maybe something else just occurs to me. Well, first of all, let me get that in. That's good news that 6, patients are on the verge of being discharged, and you've explained the context of that. Let me not dwell on that too much. As that good news is coming through, unfortunately, overall, there's a rise in the number of patients that you are taking care of. What are the latest figures for Lagos State?
Was that question for me?
Yes, it is.
Sorry, could you say that again?
What are the figures as of this morning of COVID-19 patients in Lagos State?
How many patients do we have?
Yes.
We had few more cases yesterday. I believe it was about 10 or 12.
Okay.
I saw the numbers before I logged out. Excited that the patients will be going home soon. He didn't know because of protocols and all that what exactly. Hello?
Yes, we can. You're still with us.
Yeah, when exactly they will be discharged, and that was why he said possibly today. Just to be honest, I believe he was being cautious when he said about to be released. We are doing everything to make sure that we have, if 0.1010 error margin.
Okay.
That's why it didn't come out right away to say yes and all that. So we wanted to be double sure, triple sure, and anything that goes above that.
Okay. And what you've just said is that there are certain protocols to being declared cured. You said two tests are necessary. 2 negative tests are necessary.
Yes. After 2 negative tests, the patient is technically deemed negative. That means that there's no detectable virus in the person's system.
Okay.
That science can pick up. So make sure that we're all on the same page and the person being discharged back to the community is safe for everybody. So we're doing that simply to make sure that Lagos and the entire nation is safe.
Okay. Maybe something else just occurs to me. Well, first of all, let me get that in. That's good news that 6, patients are on the verge of being discharged, and you've explained the context of that. Let me not dwell on that too much. As that good news is coming through, unfortunately, overall, there's a rise in the number of patients that you are taking care of. What are the latest figures for Lagos State?
Was that question for me?
Yes, it is.
Sorry, could you say that again?
What are the figures as of this morning of COVID-19 patients in Lagos State?
How many patients do we have?
Yes.
We had few more cases yesterday. I believe it was about 10 or 12.
Okay.
I saw the numbers before I logged out today and all that, but honestly right now I can't tell you. But I know the national is 63 and we're at 44.
Okay.
We're at 44 or 45.
Okay, we've seen the pictures, and this is a very dynamic situation. We've seen pictures from the converted former Onikon Stadium that now is the Mobolaji Johnson Center. Is that at a more advanced stage of readiness now? Should we need them? The isolation.
I didn't hear your question. Could you repeat it?
Okay, the isolation center being prepared in the former Onikon Stadium, is that at a further advanced stage of readiness in case we need them?
Did you say ventilators?
No, I said isolation center. Isolation center, the main isolation center in Lagos State, the former Onikon Stadium. Is that?
Oh, yes. That is coming up soon. It should be ready in another few days. And that's just us being ready. That is being done in partnership with private consortiums and all that.
Okay.
And we're ramping up just in case. But right now, we have what we have at 44 or 45 cases. And in that, you have number of people that have been discharged and all that. So we're just being careful and being prepared to the best of our ability.
I want to thank you very much, Dr. Ronke Agoro, for coming on and updating us on the situation. Wish you all the best. Thank you. Okay, so that was Dr. Ronke Agoro of the Lagos State Communication Center in this COVID-19 project. So a special term. As I said, I don't know, the phones might not actually work, but I don't know. That has nothing to do with COVID-19. COVID-19 no catch the phones, but what we're doing is looking across the board, but see if you can get in. Use that number, and we'll see if we can get 1 or 2 calls in. But the president's article, Twitter speech, I don't know how to communication. The president's communication yesterday had said that look, people should, throw their lot behind authorities, listen to them, whether federal, whether state, and, and just help us, because we should help ourselves.
I think there's nowhere you can go to now, because even if you want to travel outside,
no, you can't do that.
It's on lockdown.
It's on lockdown.
So we must help ourselves.
We must help ourselves.
You know? So in any little way that you can assist your neighbor, in any little way you can help, you know, the people in your community, whether you're a community leader, you're a politician, you must find how you can, you know, assist people with the little cash that you have. Because if you think that it's not going to get to me, you might just be joking, you know. So everybody, this is the time to be a true Nigerian, you know. If you need to buy sanitizers for that Mabuki or whoever is around you,
do what you can.
If you need to buy a bucket that has tap with soap, you know, around in your community, do it.
So that people can wash hands.
They wash their hands.
It's good you went there. This whole matter about people should not forget about soap and water.
Soap and water.
How
very, very crucial.
Everybody has access to soap and water.
Yeah, exactly. You know, if you need to do the simplest of things, you know, just make sure you do it.
I actually managed to get Adegbola, if I got that right. Adegbola in Iju. I don't know. Good morning.
Good morning.
Okay, please go ahead.
Yeah, I just want to use this opportunity to really thank Lagos for the wonderful job that I was outside yesterday. I drove past the corridor. I saw the government using sanitizer, using chemical to spray the buses and that is really encouraging.
Okay.
Really encouraging.
Yes.
We need to thank our government.
What's your experience in Iju there in terms of people complying? Adebola has gone. Okay. I was going to see if I could get a few seconds about how well
I think like the government is trying to disinfect all the bus stops and some motor parks, you know,
I saw that.
which is good.
Yes,
but because even in China, when they wanted to do it, everybody was home.
Yes,
and they started doing the disinfecting and all that, you know. So we need to support government in any way. We need to support government.
We've got to pack up now, but I want to thank you very much, Asuko. I would have said, you know, we'll do this again tomorrow, but then we don't do Saturdays. Nevertheless, there is still Monday there.
Yeah, exactly.
Asuko James, you know, assignment editor, TVC News. And also our thanks to Dr. Ronke Agoro, who came on as well. And no doubt, as well as all our reporters that had put out earlier reports and that we also showed you again. So that's our program today. Please join us on Monday for a fresh edition. And please stay safe as possible. Coronavirus is out there. Our people are saying that they don't, some of them are saying that I don't believe there's anything like coronavirus. No, it actually is out there. So that's our program. Be safe. See you on Monday, God willing. Bye-bye for now.